Okay, so let's talk about how to ensure that your baby has a good latch. Here's a baby. Here is a boob. Of course, both of these are models, obviously not a real breast, not a real baby. I should also point out to you that this is a tongue. Some people think that it's teeth, but we know that newborns don't have teeth. So when it comes to getting a good latch for your newborn, the first thing that you always want to do is make sure that you bring the baby to the breast and not the breast to the baby. Of course, I'm showing you with puppets, but if you think about it, when you lean forward to bring your chest towards your newborn, then you're going to be uncomfortable. So instead, we want to bring them up so that you can sit back, be comfortable. That's really important. The other thing that you want to think about is how to aim them to get them actually onto your nipple. So often you will be told in the hospital during some of your first latching, especially if you are doing this during the first hour, to make your breast like a hamburger. The way that I want to think about this is like a C or a U shape so that you know what you're doing with your hand. You aim this towards the baby while sitting comfortably. Often with an actual newborn, of course, we give you some pillows and we support you. And then you want to aim your baby's nose towards the nipple. The reason being that then when they open wide, their mouth is towards the nipple. Now, when we're putting a baby onto the breast to nurse, we want to make sure that the nipple is going far enough back in their mouth. This is why them opening wide matters. And if you notice, the nipple goes pretty far back. Now, where we're trying to aim the nipple is towards the baby's soft palate. If you open your mouth now and run your tongue across the top of your gums, you'll notice in the front it's firm and in the back towards the dangly thing, the uvula, it's squishy. That's the soft palate. We want your nipple to be that far back in your baby's mouth. You are fortunate that if you just felt this on an adult mouth, your nipple is not traveling that far. Remember, we're talking about a newborn baby. So all we have to do in order for this to happen, because they have little mouths, is that they open nice and wide. And what you'll notice, so on this particular cloth model of breast or chest tissue, then we don't have large areolas. Even if yours have grown larger in pregnancy, that's cool. Or if they were larger to begin with, you don't have to necessarily involve the whole areola, but you do want more of the breast tissue in the baby's mouth than just this. This would be what we call a shallow latch. That's probably going to hurt. Instead, we want the latch nice and deep. Once the baby is latched, then you can look for a couple of things. So you want their lips to be flared. I think of it like fish lips. You don't want them like this, because what we're trying to do is make sure that it's a good deep latch and nothing hurts you as the parent who's actually nursing this child. Once your baby is latched on, then you should be able to tell that they're eating. You can look for their cheeks moving. You can listen for swallowing, and you should be comfortable and they should be comfortable. These are the things to know about a good latch. So your baby's mouth should be nice and wide. Your nipple should go far enough back that it doesn't hurt and it's towards your child's soft palate. Their lips should be flared out. They should be sucking and swallowing.